So the Health Department has recalled its revised contact tracing, quarantine and isolation protocols, which were released last Friday. The COVID-19 Ministerial Advisory Committee recommended that quarantine and isolation is no longer needed for people presenting with no COVID-19 symptoms. So let's get you some clarity on exactly what this means. We're joined now by Dr. Lesley Bamford, who is the COVID-19 team leader at the Department of Health. Dr. Bamford, great to talk to you this morning. It's a bit of to and fro, isn't it, just in terms of what the right thing is to do. Just give us a sense of where we are at now in terms of what the steps should be if someone tests positive or has come into contact with someone who's positive for COVID-19.
Well, good morning and good morning to the viewers. So I think it is true to say that there is some level of lack of clarity. Mm-hmm. As you correctly said in the intro, the Ministerial Advisory Committee has issued an advisory giving some strong and different recommendations around isolation, quarantine and contact tracing. That fundamentally change how we think about these issues. I think as a health department we are in support of those recommendations, and a circular was issued. However, there clearly is the revised advice is clearly causing some confusion in terms of implementation. And I think as a department we've recognized that we need to provide more clarity. We need to have more consultation with some stakeholders, and we need to make sure that there is alignment between these new recommendations, as well as certain regulations and other guidelines that have been put in place around some of these issues. So in all likelihood, we will go ahead and implement the recommendations in future. But for now, there's a need just to pause so that we can make sure that everyone understands the new recommendations correctly and can implement them in the correct manner.
So as it stands, as we're talking now, contact tracing, isolation, quarantine, that stays in place?
So we are expecting during the day the circular should be formally withdrawn, and then that will be the case. That for now we continue with contact tracing, and previous recommendations regarding quarantine and isolation remain in place.
Dr. Bamford, I mean, the circular in its original form, as it was released last Friday on the 23rd of December, it's pretty much in line with research around reactions to COVID-19 around the world, isn't it? That contact tracing actually isn't as helpful as perhaps we originally thought, just given perhaps, one, how infectious the Omicron variant is, but secondly, you know, if I've come into contact with someone who is positive for COVID-19, that's one person that I know of. I've probably come in contact with a whole range of other people as well who might be positive for COVID and aren't presenting with any symptoms.
Well, that's certainly true, and I think as our understanding of the pandemic has evolved, our understanding of the role of contact tracing has also evolved. So in some settings there may be value in contact tracing, particularly in settings where there are very few cases of COVID, where transmission rates are low. However, we have come to realize that in a country like South Africa, where certainly during waves there's a lot of community transmission, that, as you correctly say, we cannot identify all the contacts, particularly as the majority of people who have COVID are asymptomatic. So we have come to realize that contact tracing has far less value than we had previously understood it to have. So as I indicated, going forward, we certainly will be revising how we think about contact tracing. But because this is a fundamental shift in how we tackle the pandemic, I think there is an argument for pausing, just making sure that we have guidelines around all the details, that all our guidelines and regulations are fully aligned, and we can then proceed with a revised approach to these issues.
I suppose the next question is, if we've got this clarity around the value, as you say, of contact tracing, does that in some ways put into question the value of an exercise like screening people for COVID-19?
Well, I think we also understand more about screening and how we should screen. But certainly people who are symptomatic, who may have COVID, really should follow all non-pharmaceutical interventions, completely and 100%. And so there are times when those people should be screened and should be excluded from certain events. But I think that is really the issue, that this revised approach has implications for not just simply for quarantine, isolation, and contact tracing, but for other aspects of how we deal with the pandemic. And so that then adds to the argument, this need to rather think through the details very carefully. What are the implications for all our practices? And then to make sure that we implement those in a coherent way.
Absolutely. Dr. Bamford, before I let you go, the issue of booster shots is something that Dr. Sibongiseni Dlomo has commented on over the past couple of days. He's talking about there not being enough research in terms of mixing booster shots. You should stick to the vaccine that you originally got when it comes to booster shots. What's the latest in terms of when people can register to receive their booster shot of either Johnson & Johnson or Pfizer vaccine?
Okay, so unfortunately this is also a little bit complicated, but let me try and put it as simply as possible. So we are, for now, not mixing and matching. Anyone who has had the Johnson & Johnson vaccine, so they would have received the one-dose schedule. Anyone who had that vaccine 2 months or more ago is eligible to receive a booster dose of Johnson & Johnson. So that's quite a large number of people, because quite a large number of people received the J&J vaccine before the end of October. So they will have reached that 2-month period. With regards to the Pfizer vaccine, that of course is the 2-dose schedule, and the interval between the second dose and the booster dose is the 6-month period. Okay. So anyone who received their second dose of Pfizer more than 6 months ago is eligible to receive a booster. That is a small number of people currently, because the first people received their first dose in the middle of May, their second dose at the end of June. So people are just coming up now to that 6-month period, at which point they become eligible to receive the Pfizer booster. So we're not mixing and matching. The period for J&J is 2 months, and the period for Pfizer vaccine is 6 months from the second dose.
And you go on to you follow the usual channels insofar as your booster is concerned, as in you have to register, or you can just rock up at a vaccination site if those time periods have now lapsed?
If those time periods have lapsed, you can present to a vaccination site, and you should receive your booster.
Wonderful. Thanks so much for that clarity. Dr. Lesley Bamford, it's always a pleasure talking to you. She's a COVID-19 team leader at the Department of Health, talking all things COVID-19 here in South Africa.